Good morning and welcome to Spine. And I will add over here as part one because pretty long topic. And as we said, that we'll be starting with bones all the way to the neural fibers. That is the complete dissection. We'll try to cover the bones part and the attachments uh, today, and next time we'll be taking the internal part, that is the all the neural fibers, etc. Right, let's see how much we cover today, and then accordingly we'll finish it next time. Right, okay, so let's start. Now see, we start with very basic, right, very basic, and when we draw this, right, you know that this is cell body and this is the axon, and these are the parts of neuron. True. So in neurology there is brain and spinal cord. As such, our focus is on spinal cord, and today we'll be watching the entire spine, right? And we, by the end of today's session, you'll be able to identify every vertebra with a very good precision. But just few general things, few terms which we'll keep on using. Say in case of brain, when we divide it into two parts, right? One part which is the outside part, that is the outer aspect, and second one is the inner one, right? So this outer aspect, that is consisting of cell bodies, right? So that is consisting of cell bodies, outer part. You also call it cortex, right? You also call it cortex, cerebral cortex, the outer one. And when we are asked about, so it is called as the gray matter, correct? It is called as the gray matter. Easy. When it comes to inner aspect, so obviously it will be consisting of axons, right? And this would be called as the white matter. White matter. And if outer is cortex, so then inner is medulla. Right? To remember this thing very precisely so that you never ever commit mistake. I don't know whether it is a coincidence or it happened like that, but see, so beautiful. O, C, C, G. You write any of these things, and in order to write that thing, it is very curvy. Correct? O round, C round, C round, G round. Okay. Against that, when you see I, straight line, A, M, let's write W also like that, W, right? So I, A, M, W, they all are very linear, right? Linear. So this is very easy to remember. That means you will never be mixing that on outer side. You'll never be confusing whether there is cell body or axon. This is in brain, right? You'll never be confusing whether when the cell bodies are there, so it is called as gray matter or white matter, right? Simple. Then we have got all the reasons, but this is in nutshell. And when it comes to spine, it is just the reverse bus. It is reverse, right? So how the reverse? Just this much you remember, right? More we'll see as we'll discuss the spine, right? We'll discuss the spine, but this is the inner core, inner part. So this one is gray, inner gray, and this outer is white. So when we say it is gray, so gray means what? Gray means it is cell bodies, right? So that means this white is what? White, right? White is what? White is axon. So over here there are axons, right? And there's a cell body. You can consider cell body is like CPU. That is where the processing is going on, will be going on. An axon, which is carrying the conduction, right? More as it comes. But this much is the basic thing which you must remember, right? The next is, say, though this is what we'll be discussing next time, but just I'm giving you an overview. And when we draw the cut section, transfer section of the spinal cord, right? There are three major things which we have to remember. Consider that this is anterior and this is posterior. So signals, they will be, when they come, they are called as afferent, right? And when they exit, that is called as the efferent. So draw like this is afferent, this is efferent. So this is in, this is out. Out is exit. Exit is efferent. Efferent, right? When we say efferent, right? Efferent, it has to be motor, because what spinal cord receives, and that is what is sent to the brain, so that is sensory. So we call this thing as afferent. Afferent is coming towards the spine, so that's why this would be sensory, right? Though we have in past we have talked about it, but still I'm just taking this so that things become very crystal clear. Now there is, so there is anterior horn, right? There is posterior horn, but then there is one another horn which is situated over here, and we'll call this thing as lateral horn, right? Lateral horn. This lateral horn is, no, thorax part is not complete, because after today only you'll be understanding the entire osteology of the spine, that is the thoracic spine, which will be understanding it in so much detail that you should be able to identify T1, T2, T3, all the way to T10, T11, T12 with full detail, right? So that when the vertebra is given in your hand, you should be able to tell that which number of vertebra it is, to that precision. Importance in forensics. Say you come across a bone, so then you should be able to identify which bone is this, which part, right, which number, and it carries lots of importance. Okay. So lateral horn is important from the point of view of sympathetic system. It is the sympathetic system. Okay. This is what you need to keep in mind. Bas. Rest is all well known to you, and I'll just write down this and this. We remember in brain it was inner medulla, IM. In this it is reverse, right? So over here what we know is that it is the inner side that is having the gray matter, right? So this is the gray matter. When we say gray matter, that means this is cell bodies, right? This is the cell body bus, right? So if this is, so then it has to be the white, and white is going with outer part. And when it is white, so that means this is axon bus, right? And that is the central canal. It is the central canal, and importance of central canal is that is where the CSF, cerebrospinal fluid, would be there, right? So far this much is enough. And yes, when we'll see that there would be the dorsal root ganglia, right? And as it comes out, right, there would be dorsal root ganglia, and then there would be formation of all those afferent and efferent, right, those components, and then the formation of the spinal nerve. But that is what we'll take next time. Now we focus on to the bone first, right? Let's focus on the bones. So here is our spine, right? Here is our full spine in action. This spine is S-shaped, right? S-shaped. So from top to bottom, right? When we have got cervical, right? So there would be 7 cervical, right? Then there would be thoracic, right? 12 thoracic. After that, there would be big boss, right? Lumbar. They are like Gunda, right? Such big. 5 cervicals, 5 lumbars. Right? Then sacrum and coccyx, right? So this is where the sacrum and coccygeal vertebra. So if we make a total, right? If we make a total of all of them, so this is what 19 plus 5, 24, right? These are the main important 24 vertebra plus the sacrum, which has got as such sacrum is single piece, right? As such, it is like this, right? It is like this. Then there is a law of sacrum and it is like this, right? It looks like this. But there are 5 segments, right? There are 5 segments in case of sacrum. And same way in case of coccyx, these are again 3 to 4 segments, right? 3 to 4 segments in that. So this is how total, say 29 plus 4, 33, 32, 33, right? All the vertebrae. So this is how it is there. So this is a lateral view, right? And this one is the posterior view, right? So this is a posterior view. Today we'll be watching all these vertebrae individually also from various angles. So that's the posterior view, right? Watch for this spine. This is the spine which when you touch, you should be able to even feel this thing, right? The back portion, that is the spine. So that spine or the spinous process, and you can feel it. Here it is the anterior view, right? So this is the anterior view. Now let's go into depth. 3 major types of vertebra: cervical, thoracic, and lumbar. This one is most romantic and this one is absolutely Gunda, right? These vertebrae, cervical vertebrae, you will find that they are all so delicate, so beautiful, right? Thoracic is okayish, right? In between both of them, right? But thoracic, they have got one speciality, and that is that they have got presence of costal facets. Costal facets. Costal facets means that is for the ribs, right? So there can be 2 costal facet or there can be 1 costal facet. So this is what we'll keep in our mind, right? And then lumbars. So the moment you'll see it, the only thing is you can use it for self-defense, because if kisi ko maro, to, right, he'll definitely be injured. Focusing on thoracic, there are 12, correct? Few vertebrae, they will be called typical, others they will be called atypical. Atypical means there is some speciality by which we can really differentiate them from each other. So from 2 to 8, well, they are pretty similar. That means one is unique. There must be some unique feature in one. It is there. Then 9, then 10, then 11, then 12. Yes, these are atypical. So many, and yes, you will be able to identify precisely that which vertebra is what. To understand that, first we'll have a look at the schematic figure, right? So which we can easily draw and we can even label also. Then we'll see the real specimen and then we'll go for the dissection, right? So this is what body, right? This space, that is the vertebral foramen, right? It is the vertebral foramen through which the spinal cord will pass, right? And we are interested in reality in spinal cord. Then this one, each vertebra, right? They will be in association with, in articulation with above and below. So this is called as the superior costal facet, right? Because and then there would be, say, this one, this is superior articular facet. So that means there is one facet which is for the ribs, and then there is something which is for the making the joint with above and below. Okay. The transverse process, we know this part, right? The transverse process. Keep an eye on transverse process, because these transverse processes will gradually become smaller and smaller, right? And then this spine, which is like down, right? Gradually it will start raising their head, and they'll become more and more strong as we go down, right? So this one is spine, or the spinous process. That is the spine, right? In between this part, right? This one, this delicate structure is called as the lamina. Right? So if you really think like that, that's the whole body, and all these delicate structures, they are connected. This spinous process is connected with the rest of the part with lamina. This is also lamina, right? And this portion, that is called as the pedicle. Forget everything, but don't forget these two, right? That's why written in different color. So lamina and pedicle. Rest all structures, say this is what? This is that, this one is the facet. This one, this one. That is the facet for tubercle of rib, right? Because it will be articulating with it, right? So just facet for rib, right? More we'll write it. So this is how a vertebra standard look would look like, as if we are watching from the top. Now see, this, do remember that this is a very typical structure, absolutely typical, right? In this, write it over here. In this, here, this is superior articular facet, because it would be forming a joint with the vertebra above, right? So similarly, if that is superior, so then this one is inferior articular facet. Okay? Inferior articular facet. So this is done. Now we worry about these two. That is for ribs, right? So here is superior costal. Now we can easily write facet, but this is half only, so that's why we'll call it as demi-facet. That means half of the facet. It means rest of the half will be with other vertebra, right? So that means it is not so that ribs, they are connecting with only one vertebra. They are in fact connecting at the joint, right? So there would be one more vertebra over here, and that's how the whole facet would be completed. And this is where the that rib would be connected with this vertebra, right? So that's why we call it superior costal demi-facet, because it will be making a complete facet with the inferior costal demi-facet of above vertebra. So the way we have got over here, this is inferior costal demi-facet. Demi means half. Demi-facet. Fair enough? Yeah. Okay. Then this portion, this one, right? That is the costal facet for the, which is on the transverse process. And what will happen, because in rib, in rib, the rib was like this, right? This was tubercle of rib. That tubercle is coming over here. For this is for rib tubercle, because that's how ribs will be forming two joints, right? Joint between vertebra, and that is costovertebral and costotransverse, two joints, right? So this is for the for rib tubercle. Again, this is a costal facet. Costal means it is for ribs, right? Costal facet. This now you know, right? That is the spine or the spinous process, right? Pretty easy. Moving on to the next one. Here it is. Now what we are watching absolutely from the top. So this is where we see superior articular process or the facet, right? Superior articular. This one would be lamina, you know, lamina, right? And then the whole thing goes back. This one would be the transverse process, right? And this one would be the spine, right? Now this is more interesting. Same way, but the moment we'll see the real pictures, it makes much better understanding. So this is body, right? No doubt about it. This is body. Then that tough structure which is connected, body is connected with the rest of the orchestra by strong pedicles. Pedicle, right? Obviously, this one would be the vertebral foramen, right? Vertebral foramen. On two sides, so this one would be the transverse process, right? This one would be spine or the spinous process. That fine one, that is the lamina, right? And done, right? This is because this is the superior view. What we are watching is over here. That is the superior articular process or the superior articular facet. Superior articular facets. Fine. So when we say that these vertebral foramen, they will be lying one over the each other, so they'll be forming the complete tunnel, and in that tunnel we'll be watching the beautiful spine, right? Over here. Now this is anterior view. Is this anterior view important? Yes. What we'll be doing in our dissection is that we'll take the body, right? We'll remove all the structures, and then only the spine would be there, and then we'll see the structures which are which we see straight away as we remove the abdominal structures, thoracic structures. So we'll see the spine. Then we'll see that what is attached with this. Then we'll remove this body, so that then we'll be able to see the this is the vertebral foramen, right? Can you imagine? This is the vertebral foramen, this is the body, right? So if we remove the body, that means if we put a cut over here, what we'll be watching straight away, the whole spine, whole spinal cord unexposed, right? And then we'll one by one we'll start picking up the layers, and then we'll enter into the spinal cord, and that is where we'll see that how those afferent and efferent fibers are going. Where are the ganglia which are formed, right? We'll see those ganglions. And then how the spinal nerve is formed and how those spinal nerves they come out. Once you have understood this, right, so many pathologies will become crystal clear, right? So that's the whole intention. So this is, yes, not many of the structures we see over here, but important part is that yes, this is the anterior view, right? Yes. Right now, so don't worry about these are typical thoracic or what, because we are about to discuss that. Yes, as such, you are right. These are typical thoracic vertebra. And I think I should even write this over here. Well, this one is typical thoracic. I can write that typical thoracic, right? Typical thoracic means it is 2 to 8, right? 2 to 8. And you will be surprised by the creativity of the god, that how he has defined these vertebra with so much precision that you just look at it and you'll say, okay, which number of vertebra it is. Now from the side, in the side, rest all the things are known to you, right? So this is like body, and this one would be that superior costal facet, right? Sorry, this one, can you just see it, or I zoom it? Yeah, this one. Okay, see, this one is superior, this one is superior costal facet. Over here, this one, right, that is the inferior costal facet. But what I really want you to look at it is this portion. This is a notch, right? But this notch, when the other vertebra comes in contact, the superior articular facet must have been superior costal facet, right? Huh. No, superior articular facet and must have been superior articular facet in third schematic figure. Wait. Where exactly? 2, 3. So 1, 2, 3. Huh. So this, you're talking about superior articular process. This one, yeah, it is facet process, it's all same. Facet is face, right? On which say this is the facet, and when this part is the this part, right? This part is the process means it is part of the bone which is protruded, extended, and this surface is the facet, right? Huh. Now clear? Huh. See over here, when I say this, right? So we'll call this superior articular process, right? See the bone. But when we talk about this surface, so we'll call it facet, right? Superior articular, writing in short. Watch for spine. How gracefully, right? It is pointing down, right? Keep in mind. I was talking about this part, right? The arrow which I made. This is a notch, right? This is a notch. So you will call it inter as such, right? This is a notch, right? This is a notch cut. So this is on the inferior side. So can I say inferior vertebral notch, right? We say inferior vertebral notch. But when the second one would come, the second vertebra would come, when the second vertebra would come, right? Here, when second vertebra would come, now this particular notch, right? This one, this one, this one, this one, they are now converted into what? Foramen, right? This is the thing. And it is important because through this foramen, the spinal nerves will be coming out. So in case if anything happens to this body, right, it makes complete sense now. Okay, if anything happens to this body and this body breaks, when they say there is wedging, right, there is wedging, so then that vertebra collapses. So it means it will be affecting this particular space, right, this particular space, and the nerve which is coming out, obviously that nerve would be compressed, and that leads to all complications. This is the reason why bone health is so important. It's so vital, right? So this is the importance of what exactly is intervertebral foramen which is between two vertebra, right? Coming back to this, and I'll show you next time. I'll be showing you even the MRI spine, right? MRI spine, and where I'll show you even the nerve compression. I'll show you that how to see that nerve compression. And I think we'll take it on Saturday. We'll take it on Saturday because Saturday, next time we'll be completing the spine, and on Saturday we'll learn MRI, right? So the basic of MRI, and then you yourself will be able to say, okay, yes, this is the intervertebral disc, and there is desiccation, there is decreased water sample because nucleus pulposus is gone, and looks wise it will look completely normal, but then you'll be applying your logic that what is happening in T1, what is happening in T2, and then I'll tell you the principle. You implement that the way you did coronary angiography, same way you will diagnose. I'll be giving you two sets of MRI. One would be normal, another would be abnormal, and you will be able to pick up instantly that which one is what, right? That would be like your test. Same like coronary angiography, we'll do it. So we'll see the same patient, we'll see the CT scan in which we'll be getting some idea, but the moment you'll do MRI, and you'll find, you'll be mesmerized that so much of information you can obtain as if you have entered into the spinal cord and you have entered into the spine, and you are actually feeling that what type of intervertebral disc is, and then obviously the nerve compression and everything you'll be seeing, right? So here it is, just in one word, this is inferior vertebral notch, which would be converted to, remember, intervertebral foramen. And what's the importance? Spinal nerves will be coming out, right? Spinal nerves will come out. And these spinal nerves will be carrying what? They'll be carrying everything. They'll be carrying all those fibers depending upon the region, because there are no specific paths for that sympathetic, right? There are ganglia, these are the spinal nerves, there'll be mixed nerves, there'll be sensory, there'll be motor, right? Everything is passing through them, right? So exactly it is like a conduit in which all various types of fibers are passing, right? So whenever there is compression, so it leads to two things, right? Because it is the spinal nerve which is carrying sensory as well as motor, right? Motor fibers. So when that nerve is irritated, it means sensory system is irritated, so one will start getting the pain. And because the motor is irritated, right, so in that case the muscles would be affected. That is the reason whenever there is nerve compression, there would be pain, and at the same time there is muscle weakness, because sensory component and the motor component both are affected, right? And the best part is, as you will look at the various MRIs, you'll be able to judge that how much is the compression. You'll also watch what is the relative movement, right? This is one principle I would like to explain right now only, the relative movement. Relative movement means that nerve would be extremely painful. Just think about this intervertebral foramen. If there is a nerve over here which is coming out, and now this nerve is getting compressed, but with the movement, when that nerve is constantly irritated, so it will give severe pain as the pathology increases. Yeah, like sciatica, nahi, sciatica itself, exactly the sciatica, same thing happens. In sciatica, same thing happens, right? Because sciatica's nerve roots, they are from lumbar. So when these roots, right, whenever, say if this is the spinal nerve, when there is a relative movement, so that would be very painful. As the pathology increases and it totally grips that nerve. Now there is no relative movement. So you'll find that pain would decrease, but the motor component would be badly affected, right? And you'll find that power is now decreasing very gradually. So at times when the pain goes away, so it is not a very good sign, right? That could mean that pathology is increasing, and you'll be able to see that thing in MRI, right? So here it is now, the posterior view, right? This is like the posterior view. Posterior view. I'm showing you all these views so that you also keep on watching them. It happens that when you are reconstructing 3D reconstruction of one particular part, so at that point when you are rotating, right, it should be crystal clear that what exactly are you watching, right? Because what you are watching over here, this top one, right, this is superior articular facet, right? This is superior articular facet, because the next one, the vertebra which is on the top, that will be sitting on it, and its inferior articular facet will be facing forward, right? They will be facing backward, right? Quite understandable. They will be facing backward. This is posterior view, right? Because inferior, our this vertebra's inferior process, inferior articular, these are, we can just say this would be inferior articular process. So then where are the facets? Facets are facing front. So we won't be able to see it. We can just see the spine over here, right? We can just see the spine. We can just see this transverse process. These are the transverse process. So that's how things are there. Clear? Right? Let's make it still clear. Here it is. This now we are watching from the top, right? When we watch from the top, previously this was anterior, right? This is anterior. This one is posterior. So when we were watching exactly from the posterior, we were watching these facets. So these are our superior. Now I'll start writing in bit short. Superior articular facet, right? And the bone on which it is sitting, it is the process. This one is transverse process, no doubt about it, right? This one is spine, that is all good, right? And this one is body, all good. Watching, this is from top view. So much so, when I said that when we'll be cutting the body, right? When we'll be cutting the body, now it will be still more clear. When we'll be cutting the body, if I cut it from here, what would we see? The spinal cord is over here, right? When the spinal cord is over here. So when we are watching from the front, we'll be watching straight the full spinal cord, right? So that's what we'll see. At that point also, I'll explain this thing again, but still good to know. Now see, very clear. This is the angular view, right? This is the angular view. And this angular view, we are watching it from inferior part, right? So this is the inferior angular view. So when we are watching from the lower end, now it is very clear that this is what? This is the inferior articular facet. Okay? And now there is no big rocket science when we say that it is facing anteriorly, right? So what? Right? Facing anteriorly, right? It makes a very simple logic. And this is what? This would be inferior articular process, right? So this is the process, inferior articular process. That's the body. So this side is anterior. This is the spine. So this side is posterior. And previously we were watching from the posterior aspect. So we were watching what? We were watching this part. We were watching this part. And they were what? Superior articular facets, right? And these are superior articular process, superior articular process. So simple, right? And those superior articular facets, they are facing backwards. Yeah, they are facing backwards. Okay, na? Backwards, because then and then they will be lying in close approximation with each other, right? The lower ones. Okay. Moving further, see this. No description needed, right? Which view, right? Straight away you'll say this is like an anterior view. Why was it called the inferior notch and superior notch if it is a hollow canal? Yeah, notch, right? This is a canal, right? This is a canal. So upper part, right? When you just take into view individually, right? Individually. Here, if you put the second vertebra, so then we say that yes, this is a complete foramen, right? It is like a canal. But independently, though, I would say that this is like a notch, right? This is like a notch. individually, right? So when you are holding one vertebra, so you will be calling it as notch, right? Otherwise, when two vertebrae meet, so then it forms a canal. Right? Here I wrote intervertebral foramen just to show the importance of this inferior vertebral notch, right? Just to show the importance. Got it? Great. Back to this, what I was explaining. I forgot. अच्छा चलो कुछ नहीं, we'll come back to that. So this is anterior view. Okay? This is anterior view because this vertebra, the body is over here, and these are facing forward. So these are inferior articular facet. Bus, right? And that above portion, what we are slightly watching, they are the processes, because superior articular facet will be facing backwards. Right? Superior articular process. See how beautiful this one is, our all-time favorite, right? Looks like fish, very beautiful, right? Typical cervical vertebra. Right? This is C4. All the structures, right? See all the structures, but the speciality is what we'll write. This vertebra as such is very romantic, right? See, this is the body, it is the curved body. Yes, Abdul, welcome. So this is curved body, but typically it is a saddle shaped. You know the saddle, right? घोड़े के पीछे, right? When you sit on the saddle, right? So it is the saddle shaped. Another classical thing about cervical vertebra, you will find these foramen. They are called as the transverse foramen because they are into transverse process. These are the transverse foramen. That is the speciality of this cervical vertebra. And these are for our excellent vertebral artery. Because two vertebral arteries, they will be going up, then both of them they will meet, right? Both of them they will meet, and they will form basilar artery. And this basilar artery will then divide, then will join other cerebellars, and what it will form in the brain, the circle of Willis, right? Circle of Willis. That is the blood supply to the entire brain. So these vertebral arteries, they will be going via this. Not only arteries, but even veins, right? So arteries and veins, that would be carried by this transverse process. Now we said that body is connected with rest of the infrastructure by what? Pedicle. Another point, right? Where is superior costal process present? In which one? Are you talking about which process? This is from top. Superior articular facet, superior costal facet. Well, see, those costal, well, it is for the cervical vertebra, but for C1 and C2, so you will see that they are completely different, right? We are just coming to that. Acha. Regarding the costal process, in the superior view, right, costal processes, so they are on side, na? Right? They are on the body, right? They are on the side. In superior view, how can we see the costal processes? Because see, this is the vertebra, right? This one is the vertebra. On one side, there is rib. On other side, there is rib, right? So all those connectivities, right? The costal connectivities, they are on the side. On transverse process, you can see that facet for that tubercle at the most, right? But that is also on the side. That is also on the side. So in dead superior view, you won't be able to see any of the costal, right? Because they are on the side, on both the sides. Yes, if you say at an angle, here it is. See, they are here. Uh, here they are, right? I just now remove this. You'll be able to see. Okay, na? Here it is. See this. Let me mark it and then zoom it. Correct. And now I remove this, so you'll be able to appreciate. See, these are costal facets. Clear? This one is superior. This one is superior. Superior. This one is inferior. This one, and this one is that for the tubercle of the rib. Great. Good one. Okay. So let's go. Just yeah. Yeah, pedicle. This is the khasiyat of it. See, the pedicle is so delicate. No problems, no problems. It is good to clear those doubts. So these are Siddhan, wait for 5 minutes, right? Because you have asked a very crucial question. As such, its answer is yes, 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 no, no, no. I think you got the answer, but still, I'll tell you the reason why I said that. So these are pedicles, right? These are pedicles. Pedicle is what? Pedicle is when the body is connected with rest of the infrastructure. So these pedicles, they are short, right? Pedicles are short, very short. Otherwise, if you see, as you will see those lumbar regions, right? So they are to like gundas, right? The pedicles, they are like those hitmans, bouncers. Next is the lamina. These are the lamina, right? These are large lamina. And the spine, right? It is so beautiful like fish, right? So this is the bifid spine, bifid spine, bifid, right? So this is bifid spinous process. One more interesting thing is, if you have noted, this is what? Vertebral foramen, through which what would pass? Through it, the spinal cord would pass, but not in case of this cervical. Cervical is over here on the top. So that brain, right? Then from brain, that pons, then right, then medulla oblongata. So medulla oblongata, its shape is like this, right? And then it will go. So here are the cervicals. So that's why this is a triangular vertebral foramen. Remember, this is a triangular vertebral foramen, because part of the brain would be passing through it. Because after crossing that, then the whole thing is like that ladkiyon ki wo chutiya, right? So it is actually that, because when say that what is the end, it is the cauda equina. Cauda equina is nothing but poonch, right? Ghode ki poonch is called as cauda equina. But I don't know, means since I used to study in MBBS, I used to always feel that this is like वो लड़कियां जो चुटिया बनाती है, right? I feel like that it is like that choti which is going from all the way up to down. So that way, many times, even in real life also, right? Just by looking at someone, you can revise the things faster. Can you number the specialties? Yes, yes. Hold on, hold on. I'll be coming to that. Don't worry. I'll not leave anything in doubt. Don't worry. Just few minutes. So here it is, right? The classical saddle shaped, right? Saddle shaped curved body. I got a very interesting mail. They said, sir, even the internal structures of the body are so romantic. So I agree with you, right? And that's how we should learn medicine. Why to learn it in that boring way? Okay, chala. So this is the side view, right? So you have got the superior articular facet, superior articular facet. But have you noticed one thing? This superior articular facet is facing upwards, right? Is facing upwards. Kyun? Why should it face upwards when all the sincere thoracic vertebrae, they are like superior, right? Anterior, posterior. That's how they were all arranged like this. While these cervical, they are facing like that. That is because of the skull, right? That is because of the skull. Because in skull, there are occipital facets. And with that, the cervicals, they would be connected. And gradually, these facets, articular facets, they will start changing the direction, right? That is how they will do. So over here, you will notice that superior articular facet, they'll be facing upwards because that is how it would be. There is a transition from facing backward to, that's right. That's the transition, right? And the way this one, right? If you see this one, right? That purpley line, what you are watching, right? See this one, thin line. So that is like we are just watching a nice glimpse of inferior articular facet, right? How nice, inferior articular facet. By the way, right? I should say some of you guys are you have got very good guts, but I don't mind. One person asked that, sir, can we think non-veg when you are explaining something? Boss, I'm telling you, if you don't think non-veg, so then there is some problem with your hormones, right? Definitely think that, because what really matters is how do we remember, right? So no need to be sharif when I say yes, right? These are very romantic vertebrae. Yeah, they are, right? Because see, if you think from that perspective, right, it would be very easy to remember all the characteristics of cervical vertebra. Okay? So don't be sharif. And you can write bindas that mail. There is no problem. You got it? And applicable to everyone. Right? So facing downwards, right? That is the inferior articular facet. Here it is, crystal clear, right? Because we are watching at an angle, so all very clear. Watch for one very typical thing. Apart from this bifid spinous process, right? This is the bifid spinous process, and this also, you know that this is inferior articular facet, right? Then there is long lamina, right? Long lamina, body, etc. Right? All good. Focus on this part. Focus on this part. This is, right? I'll zoom this. This portion and this portion. They are tubercles. One is anterior, one is posterior. Right? Which one could be anterior? Well, now to you are super smart. This is the body. This one has to be anterior, and that one is the spine. Right? This one is spine. This one. So this is posterior. ठीक? So in that case, I'll say this thing as posterior, and this one is anterior, and these are tubercles. For scalene muscles. Scalenus anterior, scalenus medius, and scalenus posterior are the scalene muscles. So they will be attaching over here, right? So just keep in mind, because that is, those muscles, they are very favorite muscles, very important, right? Now this is what? This is a top view. Now you should be able to answer everything, that what is this, 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 है ना? All good, right? Spine, bifid spine, right? Then this is the long lamina, this is superior articular facet, this is the body, this is the anterior tubercle, this is the posterior tubercle for scalene muscles, all good. And the triangular vertebral foramen. Now here is the joint operation, right? Where everything is connected. These are the cervical vertebra, right? Cervical vertebra. These are most mobile. And when it comes to those Gunda vertebras, right, they are the most stable. Because here mobility is important, right, to move your head. And as you go down, the stability is more important because you have to keep the weight of the entire body. So here, this one is C1, this is C2, C1 and C2. C1 is also called as the atlas, and C2 is also called as the axis because it provides the axis around which the whole thing moves, the head moves, and that axis is called as the dens, D-E-N-S, dens, right? Over here, it would be in association with occipital region of the occipital tubercles, right? The skull. And when we'll be looking at the skull, this posterior portion, right, that is called as the occipital bone, and the inferior surface is having that articular process. That is where it will be articulating, and that is where the head moves in all directions, right? So that's the movement, and that is the jointly correct called as the cervical vertebra, where it is used for movement. On to now thorax. These are the thoracic vertebrae, right? Thoracic vertebra with ribs. So ribs, that's where we see the costal facets, right? Now one thing, can you notice the whole assembly is going like this, right? Starting from here, and it is going down, it is going down, right? It is going bigger, right? So it is becoming bigger, right? So what we saw, that size of the body, size of body of vertebra, that is increasing progressively, right? Increasing progressively as you go from top to bottom, right? Top to bottom. Makes sense? Then and then this pyramid would stay stable. Now see this. 2 points, right? The joint which you see, so at 2 points there is a joint. So one over here, this one, and second joint is here. Okay? One is over here, second is over here. One with the body and second with the transverse process, right? Now can you appreciate if I remove this, or I just let me zoom. This is one vertebral body, this is another vertebral body, and see this rib is making a joint like this. Now it makes sense because this one would be this above ribs, inferior articular facet, inferior costal facet, and this one would be the superior costal facet. But both of them, they are in association with the same rib. And this one which is with the transverse process, this one with the transverse process, right? So that's how costovertebral and costotransverse joint, they will be formed. To see it with still better clarity, here it is, right? Here it is, right? So we have both of them, right? We have this, right, and here. Moving still further. Here the emphasis is on spinous process, right? Spinous process. Constantly, right, they are becoming down and down, and they are facing downwards. Rib is also articulate with intervertebral disc. Well, not actually, because intervertebral discs are where? Intervertebral discs are in between the two vertebrae, right? And then the whole thing is covered, right? It will be forming a capsule, right? And that's where we'll see we'll see this thing in dissection, right? We'll see this thing in dissection. Achha. In spinous process, one very classical thing which you have to watch is facing downwards, that is one, facing downwards. And second is, can you appreciate this spinous process and this one and this one? They are almost, they are touching each other, right? That is, they are overlapping. They are overlapping as they go below. Overlapping. Right? See, the distance is now very less, right, as compared to this. So initially these spinous processes, they are like this, but then as it goes down, right, they are like this, they are like this, right? So that is the overlapping. Transverse processes, they are horizontal, right? It has to be horizontal. Transverse process, right? It has to be horizontal. Why it should be horizontal? Scientific reason is only one, because that would be the point which will be acting like a pivot, right? That is through when the whole vertebra will be moving. So there has to be one end which has to be stable, because vertebra, these ribs, they will be making a joint from here. So for the movement, right? So these are the transverse processes which are horizontal. Articular processes, now you'll find that as we go down, right, this is now T12, right, they are almost transverse process, right? You see, they are all very small. And articular processes, right, these are the articular process. This is absolutely front and back. So that means they are almost vertical, right? They are almost vertical as you go down. See, right? As you go down, they become almost vertical. Now this is a lumbar vertebra. Still thoracic is not over, huh? Right? So just wait for some time. This is the lumbar vertebra. Now in lumbar vertebra, things are becoming now reverse. In a way that this spine, look at the spine. Now we say where the romantic cervical spine was there and where this spine, right? So this is a broad, stout, right? Yeah, blunt, I'll write that, blunt, right? Square, right? Square spinous process, right? Spinous process. The size of the body, right? Bodybuilders, right? Massive body, right? They are like bouncers, big one. And those transverse processes, they'll say, कि कहाँ है transverse process? Where are they, right? One might not even get it. Acha, this is the small transverse process, because now there is no need, right? There is no need of these transverse process, so they are reduced. Previously, they were there because ribs were taking part on that, right? But what happens to this articular process? Articular process, now they are at an angle, right? See, the articular process, there are no ribs. They are at an angle. And this angle, I would draw it here, right? These are the lumbars. See the beautiful way to transmit the weight. Articular process is now arranged like this at an angle, right? So superior articular processes, right? And the inferior articular processes. That's how the direction is. So that they sit very firmly on each other, and the weight transmission, it goes down all the way to the pelvis easily. From where it gets distributed, because that is the beauty of construction of those ilium, ischium, pubis. And then comes the head of the femur, right? That angle, which is so powerful, it straight away transmits, and then it goes to the legs. That's why that head of the femur, right, and the neck of the femur, that is so critical. Because if there is anything wrong to these, if there is anything like avascular necrosis, so this portion, due to that pressure of the body, it succumbs, it collapses, right? So this is the angle, right? Angle changes the direction. So a small theoretical part, right? That is the transverse and the costal elements. Transverse element in thoracic, right, forms the descriptive transverse process. That is, it forms the rib. Cervical fuses with costal element and forms the middle part of posterior foramen transverse area, right? The small foramens. And lumbar vertebra, it is the just very small sacrum, so it all fuses, right? So this one, the transverse process in the thoracic part for the ribs, that is when it is typical real transverse process. Okay, now starts our T1, right? So this one is T1, the highlighted one is T1. Now T1 is still in the dreamland, right? Because constantly it has to live with those romantic cervical vertebrae. So its body, if you see, so its body would be cervical in shape. So quite curvy, quite delicate, right? This is the T1. But then how do you differentiate between T1 and actual cervical if those vertebrae are given alone? Costal facet, right? And first thing first you will watch immediately is this is the superior costal facet, right? There'll be two costal facet. One is the superior, this one is inferior, right? I'll highlight them and you know this, that this one is superior costal facet, this one is inferior costal facet. But this superior costal facet, right? Superior costal facet is complete. That means it is full, because first rib, yeah, is more towards the center, and the most important, because it can be slightly up also, but the thing is that it is complete, because cervical will say vertebra, ribs, no, don't tell them to be in connection with us, right? We are cervicals, right? We won't be talking with the ribs, so they are very choosy. So that's why the T1 has to take the load of first vertebra by itself. So that's why this is a complete facet. This is classical. Now what is shown is ideal. Sometimes it is slightly up, sometimes it is slightly down, but it is on T1 fully. ठीक? The spine, right? This spine is horizontal. And as we said, gradually as they go down, right, spine from this, then finally to bus like this. So that's how the spine goes, right? So here the spine is horizontal. And inferior costal facet, right? Inferior costal facet, it is a demifacet. It is a demifacet, half facet. Because then there is superior, this one, superior costal facet of T2 ready to form the joint for rib number 2. Okay? So this, remember this part, this is very important, right? For T1, T1 is associated with 2 ribs. All the vertebrae are associated with 2 ribs because everyone has got superior inferior costal facet. So when it will come to T2, so T2 will be associated with second rib and third rib, because see, for the third rib, here is superior costal and here is inferior costal, right? So this T2 vertebra, it would be associated with rib 2 and rib 3. Same way, this one, right? This one, this is what? T3. So T3, here it is with 3 and here it will be with rib 4. So every vertebra, till the ribs they reach to 11 and 12, right? They will be attached with 2 vertebral bodies. Because if you understand this then and then, you'll be able to identify the typical vertebra and atypical. So we have talked about atypical T1, and the T1 is just one thing, full facet, right? The full facet, superior costal facet is complete and done. And rib 1 is only attached with T1, very true. Because say cervicals, they are too romantic. They say, okay, we don't want this rib fib wala business, right? So they have said no, that we have got our own costal process, we enjoy with them, right? This ribs wala bekar, right? So that's why bichara T1 has to say, acha theek hai, chalo, rib 1 aa jao, you remain with me only. And see, it has got this, what is this? That is the tubercle, right? This is for rib tubercle. So for rib tubercle. Okay. Because cervicals, when they live with brain, na to thoda ego aa jata hai. So that's how they say that these ribs are all chota mota kam, right? We are not interested. So here it is T2. That's how I used to remember. So T2 to T8, they are all typical, right? Typical thoracic vertebra. So Sharafat say everything goes like in the form of costal facets, right? Costal facet, superior and inferior costal facets, every vertebral body connected with 2 ribs, and the spinous process is long, right? Long spine and facing down, right? Facing down. Gradually they'll start overlapping, right? They'll start overlapping. But so that is the classical story of T2 to T8. But then something happens at T9, right? Now here comes the T9, right? See how jagarte rehte hain, right? This is also atypical, right? This is also atypical. What really happens is, once again, from T9, right, over here, right, there is superior facet, right? This is superior costal, but do remember, this is demifacet. Superior costal demifacet, right? So this, there is, can you see this partial demifacet over here, partial demifacet over here, this one, okay? But there is no inferior costal demifacet. So that's the highlight of this T9. So T9 inferior costal facet missing. And this would be the identification point. You might say that won't we be confusing between T9 and T1? No way you can confuse, because the moment you will see that T1, right, this T1, look at the spine. Spine is horizontal. That's why it was written over here. You got it, dost? Spine is horizontal, right? Because yes, you might confuse, like say, because say no way, if you remember like me, that this is such a romantic vertebra, right? Body is so curvy, right? So no way this delicate body can be confused with such big, such robust, such gunda chap body, you know? But the spine, that is the ultimate, right? The spine is facing down, spine facing down. So if spine is facing down, and then there is only one superior costal demi-facet, because here then you can be smart, right? You can say that this is superior costal, and deliberately, if in an exam, if it is asked, right, in viva, because in viva you can impress it better. So when you say, sir, this is superior costal demi-facet, right? Demi-facet, because you know it very well, this spine is facing down and there is no inferior costal demi-facet. 100% this is demi-facet. And when it is asked that how it will different from T1, so you can say in T1 it is superior costal facet, and over here it is superior costal demi-facet, right? Not a big thing, but looks very impressive, right? Examiner would say, right? Seriously, it happens. Right? Now comes T10. During the entire medical, and still I wonder that with what precision these things must be happening, you know, the entire body when it is getting formed, with what precision, right? We to just found out that it is over there. Now this is on T10, there is complete costal facet, complete costal facet. Whether you call it superior or inferior, nothing, but it is a one complete, because there is no other, right? There is no other facet. Now this one, yes, exactly. The spine is becoming more or less like those lumbers, right? Short, stout, right? So here is the spine. Spine is short, exactly. Spine is short, spine is stout, right? Big. So this is the T10, right? Now what happens in T11? Here only we see is, this is T11, okay? In T11 also see this, see, see this is just one facet. Here also there is one facet, here also. And now if you see both these spines, so you can say that this is stouter, right? This is like a bigger gunda. But when it is given individually, no, right? It is confusing. But this is a lifesaver. That is a lifesaver, right? This is what, that is for the transverse process. This is a costal facet, right? This is a costal facet, which is for tubercle of rib, correct? Over here, missing, right? Missing tubercular articular, right? That is missing. So over here, see, here it was present, here it is absent. How nice, right? No problems at all. So we can write it like big letters, no costal facet on transverse process. How good, how good, right? Because see, it is easy to confuse between this spinous process and this spinous process. See, though this is more square, right? This is more square, but when we compare it with the above one, right? So it is not the guarantee, but this is guaranteed, right? And there is complete single costal facet. So that is T11, right? This one is T11. This is T11 because on T10 this facet was there, right? But above. Now see, we go still further. This is T12, last ribs, right? Last ribs. Now this is T12. And it happens like why there is nothing on the transverse process, because that is rib 11 and rib 12, they are the floating ribs, right? They are the floating ribs. So those ribs, they are just connected at one point. They are not connected at the transverse process, right? Because the ribs, they are like this. They are like this, right? So this is T11, T12. So they are just hanging like that, right? So that's why there is no transverse process attachment. Another thing, yes, this is square spine, right? Square spine. But again, possible that we can confuse between T11 and T12 because both the spine as such, they look quite square, right? When looked individually. If it is together, then no worries at all. Over here, this T12 is atypical. It is similar to lumbar. It is similar to lumbar, and the facet if you see, right, it is going towards, it is completely on the pedicle. So now over here, if you try to figure out that where is the transverse process, right? See, this one is the transverse process, and suddenly there would be a ha factor, right? See, this is what, this structure, this one, right? That is the transverse process now, right? This is the transverse process. Where is the transverse process in T12, right? As if it has become Thakur of Sholay, right? Haath kat gaye, right? Again, I remembered it like that, right? So this becomes like no transverse process. In fact, transverse process is so short, right? So that thing is typical. Now see over here. Now you'll be able to judge, to figure out. See, nice transverse process. So nice transverse process. Here also transverse process, and here, as if it should go like this, but it has completely disappeared. Okay? Because there is no transverse process in case of T12. Fine. So basically, it is becoming more and more like Gunda. It is becoming like lumbar. So the body is like that, the spine is like that. Ye to bichara bhala ho, just of this costal facet. Because of this costal facet, right? We call that boss, you are thoracic vertebra, right? Clear? Now see this, the real. This is intervertebral disc. This is intervertebral disc. It is this bulging, right? So that's how the whole thing would look like. We shall be dissecting it. This one, right? If we actually cut it, right, and we take the upper portion inside, so this is what is called as the nucleus pulposus. This is the whole thing. This entire thing is the disc, right? And this one, it is pulpy material. Pulpy, right? Pulpy means soft. So that's why it is called as the nucleus pulposus, right? Nucleus pulposus. That means nucleus pulposus is having water. If this water goes away, that is called as desiccation. And you'll be able to figure out this thing in the patient with the help of MRI, the amount of water. Right? Over here, the fibers, they are like this, right? That's the direction, that's how. So that is what is called as the annulus fibrosis. Annulus is herniation. This enlarges even bigger than this, and that herniation, it goes posteriorly, because when it goes posteriorly, right? When it goes posteriorly, this would be the location of spinal cord, and then it presses the spinal cord. From here, the nerves will be going out. So if this disc goes like this, so it presses the nerve. When this disc goes like this, so it will be leading to decrease in the vertebral space, vertebral foramen, right? And that is where it will be causing the pain. And when the nerves are affected, so wherever the nerve is supplying, that entire portion starts getting the pain, right? So, sorry. So these fibers, they are called as the annulus fibrosus, right? Concentric fibers. Okay. Achha. So we stop at this point, just one small figure, because next time we'll be starting from this point onwards, right? So let me draw it. This is body, right? There is something here and there is something here. If this is the body, this would be anterior, right? And I make this vertebral foramen. I make this transverse process, and this is the spine. So it means this part. We'll do that. We'll do the revision. So this is what is called as the anterior longitudinal ligament. Next time during the dissection, we'll see this thing, right? Because all these things, they are worth watching. So anterior longitudinal ligament. Here, the spinal cord would be there. So this second one over here, that would be called as the posterior longitudinal ligament. Right? So if that is anterior, this one is posterior. So there would be, say, when the ribs are going, yes, ribs are going like this, right? So you need some stability. So over here, there would be one more. Multifidus is a different muscle. Right? All those things, they will be covered in the back. Over here, right? This portion, let me take it in the green. This portion. So anterior longitudinal ligament, posterior longitudinal ligament, and this one is inferior because this is between rib and the transverse process. Rib and transverse process. So that's why we'll be calling it inferior costo-transverse ligament. We'll watch this during our dissection. We'll be watching it. Now, they would have named it just costotransverse ligament, but no, because there is one more ligament available, and which is like this, So, and this ligament is also between, say, rib, and the transverse process. So we have to call this as costotransverse ligament, but we'll call it as lateral. So lateral costotransverse ligament, right? Rest is all easy, all good, right? So we stop at this point. Our next session, We'll be starting from this point onwards, where we'll see these ligaments and then we'll proceed all the way to the internal of the spinal cord, right? Let's go for high speed revision before I just save it. Supercostal, that would be the way, see, because this is like a top view, right? So every time it would be one after the another, right? Supercostal, infracostal, supercostal, infracostal. That's how it will be. During dissection, you'll be able to see. Tell me. Forex related question. Yeah, sure, sure. Go ahead. So let's start with high speed revision. Okay. Esophagus or trachea? Mhm. Is it duplication of esophagus? Because it happens like this. I'll show you. So from the developmental point of view, right? At times the development, it goes like this. Both these tubes, they are separate. Sometimes it goes like this, right? So if you have, okay, so if you can just send me the proper diagnosis or any of the images, right? But basically this is a congenital abnormality. So sometimes so many things can happen, right? It could be because this is developmental anomaly. So in that case, so you need to give me slightly more details. But yeah, at times if the congenital abnormality is beyond certain level, so then it is difficult to fix it. Though it is not impossible, but the results are not that promising. Still, you can send me a mail with more details, right? Whatever the details you have got. And if there is any image, then that is well and good. That would be the best. Any of the this radiological image. So let's start with this cell body, axon, right? That's a part of neuron, spinal cord. And in brain, outer cell bodies, cortex and gray matter, that is curvy. This is inner axon, medulla, white matter, and that is linear, right? The gray matter would be inside and the outer white axons will be present. That is in case of spinal cord, right? So here the exit is efferent. Efferent is motor because it will be going towards the muscle. Sensations, they will be carried in. That is, if it is coming, so it is afferent, they are coming, right? Lateral horns, they are for the sympathetic system. So here it is cervical, thoracic, lumbar, sacrum with the 7, 12, 5 and 5 sacrum segments and the 3 to 4 coccyx. Right, here is the entire spine, anterior view, and this is the specialty, cervical, right? So that is, right, that is the cervical. Thoracic, typical thoracic from 2 to 8, atypical 1, 9, 10, 11, 12, and the lumbars, they are like gundas, big bodies, square, spinal process, etc. These are all the parts which you know now very well: body, supercostal, vertebral foramen, superior articular facets, costal facets, transverse process, spine, right? Over here also, this is typical thoracic 2 to 8. Think of like this one, right? This would be the hemifacet and which will become the complete facet when it will be coming in contact with the rib, with the vertebra above, right? On the transverse process, that's what we see. This is for rib tubercle costal facet, right? Same. There's a spine, lamina, transverse process, all those parts. This is all anterior view. Here we emphasized on intervertebral foramen because it is formed by inferior vertebral notch and the superior vertebral notch from below. And that's how it will form the intervertebral foramen. And don't ever forget that it is the spinal nerve which will come out of it. And that's our area of interest, right? So here the superior articular facets, they are facing forward and backward, while in case of cervical, it was superior and inferior, above like this. So gradually they keep on changing their direction, right? Transition is there. So this is from top, right? And here it is facing backwards, same thing, right? Inferior articular facet, they are facing forward, and superior articular facet, they are facing backwards, right? Spine is good, all good. These are our sweet little typical cervical vertebra, right? Bifid spine, large lamina, pedicle is short, curved body, and this is a triangular vertebral foramen, right? And then there is presence of transverse foramen. Never ever forget that. And that is for vertebral artery and the veins going towards the brain. Saddle shaped curved body. This is superior articular facet. Here the articular facets, they are facing upwards, right? Because they will be in connection with the occipital, right? And then that thing continues. This is the speciality, that is the posterior and the anterior tubercles, which are meant for scalene muscles, right? They are for scalene muscles. Rest is all known to you. This you can figure out. This is this is cervical, right? C1, C2, C1 is atlas, C2 is axis, and there is presence of dens, right, which acts as a central axis. Size of body increases progressively from top to bottom at 2 points, right? One which is with the transverse process and second is the vertebral body. Thus two joints are formed. Spinous process, they are going down and then they are overlapping. Transverse process, they are becoming horizontal. Articular process, almost vertical, right? Now they are almost vertical. In cervical, it was horizontal, right? Now they are almost vertical. That's how. And after becoming complete vertical, they start giving the angles, right? So now the angle becomes like this. So this superior one, which was initially they were like this, so now so they have tilted this much, so that the bond joint which forms, that is good, right? That can transmit the weight easily. Spinous process, broad stout, massive small transverse process. These are the differences. Classical, body is cervical in shape and the superior costal facet is complete. This is the point, right? This is the point, and the spine is horizontal. So this is what we are talking about, the T1. That's our T1, right? So this is our T1, and this is superior costal facet is complete, right? These are all spine horizontal, broad body, cervical in shape. Typically T2, T3, right? First, so this is upper, this is below, right? So there is superior and inferior costal facet. Long spine, something which you can never miss, their typical long spine. And then there is facet even on the transverse process. So this is all good, easiest to identify. But by the time it reaches to T9, right? T9 has got, because gradually things will be going all the way. We want to lose the ribs because no more ribs will be connected. So over here T9 would say, chalo, I'll go for the superior costal demi facet, right? Now it goes to say next one. So this is what happens, complete costal facet, right, on T1, and then there is tubercle of rib, because T10 is still at least connected with the transverse process. T11, T12, they are floating. So when they are floating, so we won't be finding any costal facet on the transverse process, right? No costal facet. And on T12, so this is as good as thoracic, right? As good as thoracic. Square spine, right? They said facet nahi, whole transverse process is absent, right? Whole transverse process is absent. No transverse process. So forget about the facet of the tubercle of rib, right? So it is not there. There is the intervertebral disc, how it looks like. This is nucleus pulposus, very pulpy, watery nucleus, which is quite soft, and it has to remain in that condition. Annulus Fibrosus, these are the fibers which are over there. We talked about anterior fibers, that is anterior longitudinal fiber. This is the posterior longitudinal ligaments, and here is the inferior costotransfers and the lateral costotransfers. The superior one will be above, right? So they are like superior, inferior, superior, inferior. They will go in pair. During dissection, we'll be able to see that, right? So thank you so much. We stop at this junction, and next time we'll carry from this point onwards, right? Using these words, and then we'll be going for CT and MRI using the same terms and the same our knowledge base, right? Thank you so much. Putting this file into our folder, right? Thank you and bye bye. Bishkek. Okay. Huh? Or send a mail.